High blood pressure, also known as hypertension, is one of the most common health conditions affecting older adults. In fact, millions of people over the age of 60 take medications every day to keep their blood pressure under control and reduce the risk of heart attack, stroke, kidney disease, heart failure, and other serious complications. Among the most commonly prescribed blood pressure medications are Amlodipine, Losartan, and Lisinopril. These medications have helped save countless lives and are considered safe and effective when used appropriately. However, many seniors have questions about how these medications work, what side effects to watch for, whether they can be taken together, and if there are lifestyle habits that can improve their effectiveness. Today we will talk about, are you taking Amlodipine, Losartan, or Lisinopril for your blood pressure? What many seniors don. So, before we start, make sure to hit the like button and subscribe to my channel. Why high blood pressure is so dangerous? High blood pressure is often called the silent killer because it usually causes no symptoms until serious damage has already occurred. Over time, uncontrolled hypertension places extra strain on blood vessels throughout the body. This can increase the risk of heart attack, stroke, heart failure, kidney disease, vision loss, aneurysms, peripheral artery disease, cognitive decline. Because blood pressure often rises gradually with age, regular monitoring becomes increasingly important after 60. Treating high blood pressure significantly reduces the risk of many of these complications. Understanding amlodipine. Amlodipine belongs to a group of medications called calcium channel blockers. It works by relaxing and widening blood vessels, allowing blood to flow more easily. As blood vessels relax, blood pressure decreases and the heart doesn't have to work as hard to pump blood. Doctors commonly prescribe amlodipine for high blood pressure, chest pain caused by reduced blood flow to the heart, certain forms of coronary artery disease. Amlodipine is usually taken once daily and often provides 24-hour blood pressure control. Common side effects of amlodipine. Most people tolerate amlodipine well. However, some individuals experience side effects, including swelling of the ankles or feet, flushing, headache, dizziness, fatigue, heart palpitations. The ankle swelling associated with amlodipine is one of its most common side effects. Although this swelling is usually not dangerous, it should still be discussed with your healthcare provider, especially if it becomes severe or is accompanied by shortness of breath or chest pain. Understanding Losartan. Losartan belongs to a medication class called angiotensin receptor blockers, or ARBs. It works by blocking a hormone called angiotensin II, which normally causes blood vessels to narrow. When this hormone is blocked, blood vessels relax. Blood pressure falls. The heart pumps more efficiently. Losartan also helps protect the kidneys, particularly in some people with diabetes. This kidney protective effect is one reason doctors frequently prescribe it for patients with both diabetes and hypertension. Common side effects of Losartan. Many people take Losartan for years without significant problems. Possible side effects include dizziness, fatigue, low blood pressure, high potassium levels, changes in kidney function. Because Losartan may increase potassium levels, healthcare providers often monitor blood work periodically. People should avoid taking potassium supplements or salt substitutes containing potassium unless specifically instructed by their healthcare provider. Understanding Lisinopril. Lisinopril belongs to a group called angiotensin-converting enzyme inhibitors, commonly known as ACE inhibitors. Like Losartan, Lisinopril relaxes blood vessels and lowers blood pressure, but it works by blocking the enzyme responsible for producing angiotensin II. Lisinopril is commonly prescribed for high blood pressure, heart failure, heart attack recovery, kidney protection in certain patients. It has been studied extensively and remains one of the most widely prescribed blood pressure medications worldwide. Common side effects of Lisinopril. Lisinopril is generally well tolerated. Possible side effects include dry, persistent cough, dizziness, low blood pressure, elevated potassium, changes in kidney function, a rare but serious allergic reaction called angioedema, which causes swelling of the lips, tongue, or throat, requires immediate medical attention. Unlike Losartan, Lisinopril is more commonly associated with a chronic dry cough. If the cough becomes troublesome, your healthcare provider may recommend switching to another medication rather than stopping treatment altogether. Why doctors sometimes prescribe more than one blood pressure medication? Many people wonder why they need 2 or even 3 medications. The answer is that blood pressure is controlled through several different mechanisms. Using lower doses of medications from different drug classes often provides better blood pressure control with fewer side effects than taking a very high dose of one medication. For example, Amlodipine and Losartan are sometimes prescribed together. Amlodipine and Lisinopril are also commonly combined. However, Lisinopril and Losartan are generally not used together for routine blood pressure treatment because combining these medication classes increases the risk of kidney problems and high potassium without providing additional benefit for most patients. Why regular blood pressure monitoring matters. Medication is only one part of hypertension management. Checking your blood pressure regularly helps determine whether treatment is working effectively. Healthcare providers often recommend measuring blood pressure at the same time each day, after resting quietly for several minutes. Using a properly fitting cuff. Recording readings to share during appointments. Home blood pressure monitoring provides valuable information because readings taken in familiar surroundings may better reflect everyday blood pressure than occasional office measurements. Lifestyle habits that improve blood pressure control. Medication works best when combined with healthy lifestyle habits. Doctors consistently recommend limiting sodium intake, eating plenty of fruits and vegetables, choosing whole grains, maintaining a healthy weight, exercising regularly, limiting alcohol, avoiding tobacco, managing stress, sleeping 7 to 9 hours nightly, following eating patterns such as the DASH diet. These habits often improve blood pressure while reducing the need for higher medication doses. Foods and supplements to discuss with your doctor. Some foods and supplements may interact with blood pressure medications. Examples include potassium supplements, salt substitutes containing potassium, licorice products, certain herbal supplements. Over-the-counter anti-inflammatory medications such as ibuprofen and naproxen may also reduce the effectiveness of blood pressure medications or affect kidney function in some individuals. Always inform your healthcare provider about every medication and supplement you take. Never stop blood pressure medication suddenly. One of the biggest mistakes people make is stopping medication after seeing a normal blood pressure reading. Normal readings often mean the medication is working, not that the condition has disappeared. Suddenly stopping treatment may allow blood pressure to rise again, increasing the risk of heart attack or stroke. Any medication changes should always occur under medical supervision. When should you contact your healthcare provider? Seek medical advice if you experience persistent dizziness, fainting, severe swelling, difficulty breathing, persistent cough while taking Lisinopril, muscle weakness, irregular heartbeat, very low blood pressure readings, swelling of the lips, tongue, or throat. These symptoms may indicate medication side effects requiring prompt evaluation. If you liked this video and would like to see more like it, please give it the thumbs up, leave a comment, and click the button to subscribe.